Hey guys, it's me and it's March. Oh, holy crap. Sorry. It is July 16th and I am frazzled because I've tried to do this video like 10 times and I've just been interrupted every single time. I made one like 2 times last week trying to do another video, and for some reason my stupid it just won't load. I'm not sure why. So I'm doing it on my phone, and if it doesn't work this time I'm gonna freak out. So it's July 16th. I am a little over a month post-op for my mommy makeover and I'm doing pretty good. I'm still really swollen. I put on these clothes to try and give you an idea of the progress that I've made. I am 187 pounds now. I'm still very swollen, so I haven't lost a lot of weight. I think I'm three pounds. I'm pretty sure I was 190 when I left for Mexico. So you can't really tell the weight loss yet because I'm still very swollen. And they tell you that you can stay that way for up to 6 months, the swelling. So I'm not really concerned about it. I could stay like this and be perfectly happy. I wouldn't have any problems just being the way I am right now. And if anything, I just want to work on my arms because you can tell my arms are still, you know, fatty and they shake and I'm a little self-conscious about them still, but the rest of me I'm really pleased with. You can tell that it's a big improvement of what it used to be. I was never going to be a stick figure. We all knew that. I didn't want to be a stick figure. I just wanted to be healthy and not have this huge flap of skin there, which I don't obviously anymore. You can see it's really flat. I don't know if you can see that. I'm still swollen right there. And I'm still pretty swollen right here. And I'm still really swollen. Probably my most swelling is right here in my hips. I don't know if I pull this down tighter, you can kind of see this lump right through here. It's right above my incision. My incision's like right here and then sinks down. So it's and I'll show you my incision next time. I don't want to get into this time because like I said, I've done this video 500,000 times already today and I don't have patience to try and maneuver and all that. So you can see my back from the liposuction is really, really nice and smooth. I used to have this big rolls right here and then another set of rolls right here, and you can tell that those are pretty much gone. I have a little indentation here and I've got a little indentation here, but other than that it's really nice. You can tell from the side, like I said, ignore my arm please. My sides are nice. Swollen here, that's okay. The girls look nice. I did end up having to get implants because if he had just done a lift, I wouldn't even have filled a C cup. That's how much fat I lost in my breasts. Basically all of it, and what was left was just skin. So when I would put on my bra, and I'd have to stuff all the skin in because that's all there was left. There wasn't practically any tissue, and even after I'd had my son, and you know, you swell up obviously in the breast area when you're pregnant and you have a baby, but even then there was practically nothing left. So I ended up getting silicone implants. I got D cups, which is smaller than I used to be. I used to be a double D before I lost all the weight and lost my boobs. So I'm still really swollen, so I look a little bit more pronounced. This one's more swollen because it's not healing right, which is totally my fault. It wasn't my surgeon's fault at all. When I left the hospital, they were both doing really good, and they told me not to pick up anything over 5 pounds the first 4 weeks at least. About a week and a half after my surgery, I picked up my son, who was 15 pounds, and I ripped that incision. So I have a gnarly hole, probably about that big. I shit you not. It's like that. It's really big. and I'm having to stuff it with gauze. It's like a string gauze. They use it to stuff into abscesses. And you gotta change it every day, and then because the goal is to have it heal from the inside out and not just scab over, because then it'll just fill up with nasty stuff. So yeah, that was totally my fault. Don't do what I did. Listen to the directions they tell you. So as far as pain goes, this breast is completely healed. I don't have any pain. I don't have any numbness. Actually, I watched a lot of videos where women would say that the nipple had lost sensation or was numb. I have the opposite. This nipple's very sensitive, to the point where it's distracting sometimes. If you're not wearing the right bra, or you're taking a shower and obviously washing, and you don't think about it, and you go to wash and you're like, oh, okay, I'm not gonna do that. Gently. So I don't know if that's gonna wear off. I kind of hope so, because having tender breasts is something that I associate with periods and pregnancy, and I got my tubes tied for a reason. So this one is still pretty numb, especially across here, and you can tell the bra that I'm wearing doesn't really show it very well, but this one is very soft, squishy. Sorry about the touching and feeling and whatnot. This one's still really, really firm. Hi, baby. Can you go, please? Go. Go on. Yes, baby. Go. Sorry, I'm not going to turn off this video again. If I have to do it again, I'm just not going to do it. So, let's see what else. Oh, okay, yeah. So you can see how this one's very squishy. If I was to jump, it would jiggle. This one's still very stiff. If I push down here, you can see that it comes up because it's still really swollen. And you can kind of see the difference in size. Don't mind my skin. The discoloring is just a thing that I have with my skin. It sucks, but you can see that this one's more swollen through here. Just more inflammation, and because of that open wound. And once that closes up, then you should really see the size go down. I'll probably have I have a good idea of what my real size is going to be in another month, when all of the swelling is gone, because like I said, I'm swollen everywhere, including my back. At night is worse. We're looking at noon right now. I've been up already for a couple of hours working around the house, doing, running around town doing chores. So I'm already swollen from being active. And so at night I'm really swollen through here. You can see kind of how flat I am. Okay, I was never going to be a stick figure. I didn't want that to happen anyways. I just wanted to be normal, and that's fine. Being a big girl was never something that I was ashamed of. It was a matter of how out of control I let it become. Okay? So if I stay this size, I'm a happy kid. I don't care. If the swelling never went away and this is how it was, I'm happy with that. I go back and look at some of my other videos and take a gander at what I used to be. I'm proud of this. And tonight's gonna be my first night back at Zumba. I'm gonna take it easy. I'm not gonna do any of the jumping, obviously. I don't want to shake, rattle, and roll those things. So, I still plan on staying fit and eating healthy and all of that. And but being skinny was never my goal, as far as the skinny in the terms of what society thinks is sexy, whatever. What society thinks is proper and what I think is proper are two very different things. They want me, the doctors say that for my height, I'm 7'8". I'm sorry, I'm 5'8", and they want me to be 155 pounds. I'm at 185 right now. my goal is 175. That's only 10 pounds away, and 155 is 30 pounds away, or whatever the math is. I can't even think of it right now. I don't want to be that small. I just don't think it would be healthy on me. I have no desire to fit into what society thinks is sexy, you know, so, because I don't think it's sexy. Anyways, enough about that. Pain. As far as pain goes, I don't have any pain here at all. I have a little bit of numbness, a little bit of tightness, that's it. This breast, tender, but not painful. This breast, more so because, you know, I have the open wound. All of my pain is in my back, where they did the liposuction. That is all of my pain. I still have pain. It gets worse throughout the day when I've been really active, and it starts swelling, and you can feel all the tissues start to swell up, and it just, it sucks. It hurts. It's not like bedridden kind of pain. It just feels really bruised and stiff and sore, and other than that, you know, I've gotten kind of used to it. I've been told that the pain, this discomfort can last, excuse me, I'm sorry. I've been told that this kind of discomfort can last up to 2 months. So I'm 1 month down, and I've also heard that it's just like all of a sudden gone, just not like a fading away, but you wake up and you're like, huh, that's weird. And even though it's painful, it's numb too. It feels like something is laying across my back, like somebody has put a sticky towel or some kind of cloth, stuck it there and left it there. And then you walk around with it and you can feel it kind of moving. And I guess that's all of the connective tissue starting to reconnect and all that. But it's still not pleasant, but totally worth it. And I don't have any regrets about that job. Okay, I'll be there in a minute. And so anyways, I'm going to end this thing because my kid's crying again. It's coming to get me, and if I don't end it, I'm not going to do another one. So if I missed something, I'll just have to do another video. It's just driving me crazy. See you guys.